When sod was cut for the construction of the maternity block, patients and staff were excited. It was anticipated that the increasing congestion was soon going to be over, but the project has been abandoned.
Our biggest challenge has always been with space. Originally this facility was constructed as a health center and converted into a hospital by virtue of an order from the ministry, without any additional structures being added to it.
Tafo Government Hospital serves as one of the major health providers for people living in the old Tafo municipality and beyond. The maternity block is expected to benefit other health facilities and reduce pressure at Compelled Teaching Hospital. Medical Superintendent Dr. Kwame Agyeman laments the situation in the hospital is being compounded by daily increase in the admission of patients.
And now as a hospital, we have to take care of the health situation or problems of the people living in our municipality. And with time, with the growth of the population, the space has become more scarce. Like the old existing space is far overfilled, that we hardly even have place to put clients. For instance, our A&E, our accident and emergency unit can house only 2 beds, and is woefully inadequate. So that at times, if we have more than 2 patients who need emergency services, we are forced to put some in the floors of the hospital.
Okay, Elizabeth Appiah, Principal Midwifery Officer at Tafo Government Hospital. My experience here for the past 10 years as a senior midwifery officer or principal midwifery officer, that the maternity wing, as so to speak, is the heart of the hospital. And the problem is that we have challenges at the labor ward where the mothers come to deliver. We have only currently 8 beds. And these 8 beds have been in existence for the past 10 years. And the hospital is growing, and we still have to accommodate all the clients that visit the facility. Really, when the clients come at night and the beds are full, if you tell them to go to different facility because of lack of bed, there's problem. And we are also asked not to turn anybody away. So this has been a major problem since I came to Tafo Hospital.
Management are sometimes compelled to refer patients to other medical centers. Dr. Agyeman and his colleagues at the facility wonder why an important project should be left at the mercy of the sun and rains. Several appeals by hospital authorities to get it completed have yielded no positive results.
If we are able to get help to complete an old existing structure, which was started by President Kufuor and has since then been abandoned. We've sent out appeals several times over the media to the government, but as we are talking now, you can verify it yourself. There's no sign of work. There's no sign of work going to start on the building as we are talking now.
And there have been several interviews, a lot of people coming and going, but the situation still remains same. And at the ANC also, now the population is growing and the catchment center is also growing. When the women come like this to ANC, you find out that some of them are even under the sun for hours. That one too is a major challenge. And also when it rains, there's no place of shelter for them, particularly at the ANC. You see workers running, the place is flooded and a whole lot.
If the structure is completed, authorities can decongest the existing structure to provide quality health care delivery. A report by Mohammed-Nurudeen.